Organisms that exhibit dimorphism and grow on Sabarod's medium are fungi, bacteria, mycoplasma, spirochetes. Correct option is fungi. Dimorphism is a phenomenon demonstrated by some species of fungi. The term literally means two forms. Sabarod's is a non-selective isolation medium used for the growth and maintenance of pathogenic and non-pathogenic fungi from clinical and non-clinical specimens. It is also used for recovery and total counting of yeast and molds in environmental monitoring. Hypertensive heart disease is consistently associated with which of the following anatomic findings? Aortic stenosis, tricuspid stenosis, left ventricular hypertrophy, pericardial effusion. Correct option is left ventricular hypertrophy. In hypertension, peripheral resistance to blood flow increases. Therefore, the heart must pump more vigorously to maintain adequate flow in systemic circulation. When hypertension is chronic, the cardiac muscle hypertrophy occurs. In transduction, DNA is transferred from donor cell to recipient cell by a plasmid, an episome, a bacteriophage, purified nucleic acid. Correct option is a bacteriophage. Bacteriophages are viruses which specifically infect bacteria. These viruses are able to transfer genes between bacteria by one of two means. In specialized transduction, viral DNA is incorporated at specific sites within the bacterial genome. The component in the cell wall of Mycobacteriaceae responsible for acid fastness are mucoproteins, teichoic acid, polysaccharides, lipid and waxes. Correct option is lipids and waxes. The Mycobacterium cell wall is very rich in lipids and waxes. These compounds make the organism hydrophobic and highly resistant to destruction by acid-base or immune mechanism involving antibody and complement. The lipids and waxes are also responsible for acid fastness. Fat embolism is most often a sequelae of fracture, infection, contusion, infarction. Correct option is fracture. Fat embolism occurs in almost all patients who suffer severe trauma with multiple fractures. It commonly presents clinically as a sudden change in mental status and shortness of breath. Renal failure may follow when single bones are fractured without concomitant severe trauma. Fat embolism occurs most often with hip fracture. Which of the following virus causes two distinct diseases in different age groups? Influenza, smallpox, measles, varicella. Correct option is varicella. Varicella zoster virus, a herpes virus, causes chickenpox in young children. Following infection, the virus enters a dormant phase in the dorsal ganglia. Reactivation of the virus occurs under condition of decreased immunology competence. Elderly individuals have a less vigorous immune system and reactivation commonly occurs in this population. The requirement for an insect vector in the transmission of human disease is a common characteristic of all infectious agents included in the genus Brucella, Betsonia, Treponema, Rickettsia. Correct option is Rickettsia. Rickettsia are intracellular organisms responsible for a variety of diseases including Rocky Mountain spotted fever and Q fever. Several species of Rickettsia exist and not all unlisted insect as a vector. Rough pneumococci grown in the presence of DNA from smooth pneumococci develop capsules. This is an example of mutation, translation, transduction, transformation. Correct option is transformation. The conversion of rough pneumococci to smooth pneumococci was the first demonstration of transformation. The mechanism of transformation involves the uptake of DNA from solution by an organism and the incorporation of this DNA into the host genome. A very high percentage of cases of hepatitis A are found in young people, recent recipients of gamma globulin, recent recipients of whole blood transfusion, persons with histories of recurrent respiratory infection. Correct option is young people. Hepatitis A has a predilection for young people in populations with poor sanitation. The virus is spread by the fecal oral route, and cities with poor sewer system will have contaminated water supply. Which of the following skin lesions is generally considered precancerous? Verruca vulgaris, actinic keratosis, intradermal nevus, seborrheic keratosis. Correct option is actinic keratosis. Actinic keratosis, also called solar keratosis, is induced by sunlight exposure, as are basal cell and squamous cell carcinoma of the skin and malignant melanoma. The lesions in actinic keratosis are small-scale papules. Which of the following is produced by a gram-positive spore-forming anaerobic bacillus? Thrush, gas gangrene, actinomycosis, undulate fever. Correct option is gas gangrene. Gas gangrene is a necrotizing infection caused by the spore-forming anaerobes Clostridia. This disease usually arises in deep penetrating wounds, especially when ischemia is present at the site. Cytopathogenic effect in tissue culture cells is used specifically for identification of certain fungi, virus, anaerobes, spirochetes. Correct option is virus. Virus causes lysis of infected cells. They kills the cells and thus are cytopathic. This property of virus has been exploited in the laboratory as a means of detecting and identifying virus. The usual incubation period for hepatitis B virus infection is 1 to 2 days, 1 to 2 weeks, 1 to 6 months, 1 year. Correct option is 1 to 6 months. Hepatitis B infection is acquired by direct parental inoculation with infected blood and by sexual intercourse with chronic carriers. Clinical disease begins 1 to 6 months after inoculation and consists of jaundice, malaise and right upper quadrant abdominal pain. Which of the following is the most common type of lung cancer? Adenocarcinoma, bronchiolar carcinoma, alveolar cell carcinoma, squamous cell carcinoma. Correct option is squamous cell carcinoma. Lung cancer is the most common cancer in men and have surpassed breast cancer as the most common cancer in women. It is devastating disease with 5 years mortality rate of 90%. Roughly half of all lung cancers are squamous cell carcinoma. Carcinoma of which of the following organs has shown to be hormonally dependent? Colon, larynx, prostate, pancreas. Correct option is prostate cancer. Growth of prostatic cancer is androgen dependent. The most successful means of retarding the growth of metastatic lesions in prostatic cancer is by castration. Which of the following are most characteristic of cervicofacial actinomycosis? Multiple ulcers, enlarged cervical lymph nodes, multiple cutaneous abscess with sinuses, indurated nodules in the skin of the neck. Correct option is multiple cutaneous abscess with sinuses. Actinomycosis is caused by a gram-positive anaerobe which is difficult to culture. The organism causes infection when tissue becomes devitalized. The tissues that are most susceptible are those in which the organism normally lives. Which type of chromosome is usually missing from the cell of persons with Turner's syndrome? Autosome, chromosome 21, a sex chromosome, group A chromosome. Correct option is sex chromosome. Turner syndrome can result from a variety of genetic abnormalities involving one X chromosome in the female. The other X chromosome is absent in all cells in the most common form of the disease. Less often it is missing from 1/3 to 1/2 of cells in a pattern called mosaicism. A summer illness that produces nodular lesions of ovula, anterior pillars and the posterior pharynx is influenza, herpes virus, echovirus that is enteric cytopathic human orphan virus and Coxsackie virus. Correct option is Coxsackie virus. Coxsackie virus causes a wide variety of disease. One of the more common manifestation of infection is herpangina, which is partially described in this question. Herpangina is a syndrome consisting of nodular lesion of the ovula and pharynx with fever, headache and dysphagia. Antiseptics differ from disinfectants in that antiseptics sterilize, kill pathogens, are bacteriostatics only, are applied to visible tissues. Correct option is are applied to visible tissues. Antiseptic are chemical agents which are applied to tissues to inhibit the growth of pathogenic bacteria or to kill pathogenic bacteria. Example of antiseptic includes betadine, alcohol, various soaps. Disinfectants are also chemical agents but they are generally more caustic than antiseptic. Which of the following distinguish a viral infection from other microbial assaults? Necrosis, chronicity, interferon production, intracellular infection. Correct option is interferon production. Interferons are glycoproteins produced by cells when invaded by viruses. These glycoproteins are secreted into the medium by infected cells and they induce the synthesis of antiviral proteins in uninfected cells. The uninfected cells thereby become resistant to viral invasion and the infection caused by the virus becomes attenuated. Interferons also affect the immune system.